The gentleman from Virginia, Mr. Griffith, 5 minutes for questions.
Thank you very much, Mr. Chairman. I, too, am very appreciative of the fact that we have all of these witnesses here, and the testimony that you gave on each of the various issues was very important and enlightening. Mr. Chairman, I will take a minute to talk about Lyme disease and ask a question of our witness on that, Ms. Smith. But Lyme disease is a growing problem throughout our state, but it's endemic in Northern Virginia. Our representatives from the local, state, and federal levels are working aggressively to raise awareness about this issue for our citizens and medical providers to encourage prevention, quick diagnosis, and treatment. My colleagues and I in the Virginia delegation, particularly Congressman Frank Wolf and Rob Whitman, appreciate you having this hearing. I should also mention that Barbara Comstock is working on this in the Virginia House of Delegates as well. Ms. Smith, H.R. 610 requires that tick-borne diseases advisory group include members that represent state and local health care professionals, individuals who have firsthand experience with tick-borne disease, and representatives of a tick-borne voluntary organization. How do you think this will help to enhance communication amongst the federal agencies?
Well, I think, unfortunately, what's happened right now is oftentimes what I see is that the agencies, they're trying to do a good job in their area, but it's not always communicated into other areas as to what kinds of projects they are doing. Plus, there's really not a national strategy to attack tick-borne diseases. And so over the 30 years, what I've seen, the numbers have grown, greatly, the numbers of ticks, the numbers of diseases. And so if you put people on there who have perspectives, for example, we have no clinical treating physicians have a perspective right now, are able to give their perspective to the federal government about what research projects they feel are important. They're seeing a lot of people with very serious chronic Lyme disease, which is different than just getting a tick bite and getting, a few weeks and getting better. So they're seeing people with these debilitating symptoms. They have all this knowledge that they have gleaned from many years of treatment, and they are able, for example, to look at the results of Lyme disease testing, and sometimes, even though the test may come back and it says it's negative, they're able to read the bands from their clinical experience and determine, yes, these people really do have Lyme disease and they require extensive treatment. And so they would be able to take this kind of knowledge, because one of the biggest factors, and I think everybody agrees on this, we need testing that is, a gold standard. We don't have that now. We're missing so many patients, and they go on to develop these intense symptoms that are not only causing them a lot of health disability, but are also causing, obviously, great tremendous costs to their families, to the government, etc. So if the clinicians could provide their input, it would be a better chance that we could get diagnostic tests. Also, tests need to be found that will determine whether someone has active infection.
And you believe that this bill will help that, and I do appreciate it and appreciate your testimony. I am going to move on to another subject because, unfortunately, while I'd like to talk with each one of you, I only have a few minutes. That being said, I'll move to the NASPR bill and pick up where Congressman Whitfield left off. It's a very serious issue in lots of the country. It's particularly a serious problem in my district in Southwest Virginia. A study done there by the United States Attorney's Office for the Western District of Virginia found serious problems, that this was a major impact on our region. And the study also cited that just 4 counties, which have 1% of Virginia's population, accounted for the Virginia State Police spending 25% of their statewide undercover purchase funds buying prescription medications in those 4 counties. Likewise, the Chief Medical Examiner's Office in Roanoke says that deaths are up by 40% as a result of the activities with prescription drugs. Doctor shopping contributes to this spread. I think we need to do more to prevent this practice, which is why I support the lock-in mechanism that many private insurers are utilizing, and I think that would be helpful. Dr. Stack, is there anything you'd like to, in 23 seconds, tell us that you didn't touch on when you were answering?
We share that this is critical, but you just touched in your own testimony how it's a variable problem that affects different communities more intensively, which is why we don't believe a one-size-fits-all for some of the other strategies is appropriate, because it will misapply strategies in some areas and underapply them in different places. So we believe NASPR, everyone agrees, all the stakeholders agree, these PDMPs are an essential tool. The other strategies, we could have a longer discussion another day about where they may be best applied.
Appreciate it very much, and with that, Mr. Chairman, I yield back.
Chair, thanks, gentlemen. Now recognize the